set, ready? Let's do it. What is ultrasound? Ultrasound really means or refers to high frequency wavelengths. That's it. Wavelengths that humans can't hear. Bats can hear these wavelengths. It has to be above 20,000 kilohertz. If you look at this image right here, you can get an idea. That red margin is too high to hear, okay? Ultrasound and sonography have been around for a very long time. Even animals use it. For example, bats use a form of sonography called echolocation, where they emit noises that bounce off their environment and they can figure out the distance. Because they're aware of how long it'll take the sound waves to come back to them. Even whales use a form of sonar in order to see what's ahead of them. And it's how they communicate with each other as well. Even submarines emit sound waves in order to determine their position and how far they are to land. Or where enemies are. So really, let me show you right here. This device emits wavelengths into the body and they bounce back where it is then interpreted into results that you can view on the screen. It's an amazing process. Have you all seen this before? Yeah, so. This is critical to know. This is the foundation of medical healthcare. So I want to introduce some signs relating to these concepts because poor interpreters having to finger spell all of these, it's just too much. So check out these signs. We'll start on the left side with the sagittal plane, which is a horizontal axis going through the middle of your body, or vertical interpreter. The coronal goes through the side of your body vertically. And the transverse plane goes horizontally through the abdomen. So there are the three planes of human anatomy.
Through the front? Okay, yeah, through the front.
All set? So now you see what these planes look like in action. These pictures show CT scans. This is my sign for it, CT. MRI is slightly different. It's much bigger and more intimidating to enter. So that's an MRI machine, whereas a CT machine is quite thinner. Of course, you want to introduce these terms to the patients so that they have an understanding. And I even show them the signs to encourage the spread of these new concepts. So this first picture, you can see the transverse plane. And you notice how on the left side, there's some solids. That's actually the liver. Versus the right side, you can see the spleen. In that center photo is the coronal plane. You can see the liver up at the top, and then the intestines right underneath it. You've got the pelvic bones down at the bottom. And then in the rightmost picture is the coronal plane, sagittal plane. where you can see bones and intestines.
So what plane would you say this is? Is this transverse, coronal? What do you think? Is it coronal? I think this is this, or this one right here, yep, coronal. Yep, that is correct. That is the coronal plane, which goes this way, the frontal plane. You see that black right there? That's the lung. And then right under that, there's pink. That's the liver that you're seeing right there. And then it's pretty obvious that the intestine is below that. You see the way it's pretty distinct. And then right there, that hollow spot, that is the urinary, yeah, bladder. And because there's a difference between the urinary and the gallbladder, so there's a distinction there. Now we control the orientation of our machine right here. Be sagittal or transversal, that's in our control right there. As we're, and you'll see the 3 planes utilized. So sagittal is going to look like this. So sagittal, transverse will look this way. And then coronal is going to look like this. Now, this is the kidney right here. Yep. It kind of looks like a can, like a kidney bean, right? The kind that you eat, just kind of funny. Ureter, right, is with the kidney, it's that tube that's attached. You can see that in the image. Below, you can see the sagittal, it's kidney from the sagittal plane. And when you flip to the transverse plane, that is going to look like this on the right side. So it's essentially like it's cutting through the middle, just look like this. And that allows to see the blood flow. And the vessels that enter and leave through the skin. So I just want to review those terms one more time because they really are important. And from there, we can start having a little more fun once we know that we are. So medial is going to be signed like this, which means through the middle, right? Medial, like this. And lateral is like this. It's on the outside. Superior means above, right? And then below is inferior. Anterior, and then posterior. So in front of and behind. Those are what those terms refer to. And in healthcare, we are constantly reviewing this terminology. It's so important that we are comfortable with each and every one of these. And it's important as interpreters too that as you're interpreting each of these terms, you recognize, you know what it's referring to. And now we're going to go through to test your understanding of these terms. So starting with you, that first line.
Medial?
That is correct. And it's important that we can use these terms specifically in relation to parts of the body. So the second one for you.
Lateral?
That is correct. Next.
Lateral?
Again, yep, right.
Medial?
Uh-huh. Oh, can you do one more time again?
Medial?
Oh, no, not quite. Where is the liver? Uh-huh. Livers, and then where would the kidney be? Yep,
Lateral,
exactly. And you?
medial.
Yep, that's right. Awesome. See, it's not that tough. We all got through it. And again, it's just really important that you can reference all of these accurately. Just go ahead and take this off real quick.
Interpreter is switching.